Today, we will delve into the complexities of systemic lupus erythematosus, commonly known as SLE. This particular autoimmune disease, also known as AID, presents as a myriad of challenges for those affected, one of the most debilitating being fatigue. However, it is crucial to understand that fatigue is far more intricate than merely feeling tired. It is a multifaceted condition that encompasses both physical and psychological dimensions, profoundly influencing the overall well-being of individuals diagnosed with SLE. The following presentation will cover an introduction, ethical considerations, background, epidemiology and relevant pathophysiology, critiques of previous studies, gaps in knowledge, methodology, implementation, result, conclusion, as well as a recommendation. Fatigue in SLE patients often manifest variably among individuals, with some reporting mild tiredness while others experience profound exhaustion that impedes their daily functioning. Despite its prevalence, there remains a significant gap in understanding the underlying mechanisms and causes of this pervasive fatigue in patients with SLE. Of particular interest is the relationship between self-reported levels of physical activity and the severity of fatigue among SLE patients. This intriguing correlation remains under-researched, prompting essential questions, such as how does regular engagement in physical activity influence fatigue levels? Do patients who maintain higher levels of physical activity report decreased fatigue severity? The primary objective of this presentation is to explore the potential impacts of physical activity on the severity of fatigue in individuals with SLE. We will investigate how incorporating physical activity into treatment and management plans might alleviate the complex symptom. Furthermore, we will address the ethical considerations that must be taken into account when designing and conducting studies in this sensitive area of research. SLE can be characterized by various symptoms, one of which being fatigue. Fatigue not being just a feeling, however, a complex condition. When it comes to ethical considerations, we investigate this condition as nuanced as fatigue and SLE. It's critical to prioritize ethical considerations. This includes ensuring informed consent, respecting the autonomy of patients, and acknowledging the potential risks and benefits associated with increased physical activity. Moreover, we will consider the implications of our findings and the importance of conducting research that not only validates patient experiences, but also respects their overall well-being. The relevance of understanding the relationship between physical activity and fatigue in SLE cannot be overstated. By elucidating this connection, we may uncover strategies that significantly improve the quality of life for patients. Recognizing how targeted interventions, including tailored physical activity programs, can mitigate fatigue and lead to better management of SLE and informed clinical practice. We will also discuss the feasibility of conducting robust research in this domain. This includes identifying appropriate methodologies, potential study populations, and realistic outcomes that researchers can strive to measure in an ethical aspect. By outlining a clear framework for future studies, we can pave the way for more comprehensive and impactful research in the intersection of physical activity and fatigue. Maintaining ethical standards in research is absolutely vital, especially when the focus is on vulnerable populations such as individuals living with chronic illnesses like SLE and other autoimmune diseases. These populations often face unique challenges, not only concerning their health, but also in terms of psychological and emotional well-being. Therefore, it is imperative that we approach research involving these individuals with the utmost care, compassion, and ethical consideration. The type of study we are conducting adheres to widely accepted ethical guidelines, which serve as a framework to ensure the safety and dignity of all participants involved. Our research methodology has been designed to be non-invasive, primarily relying on self-reported surveys and standardized measurements to gather data. This design minimizes the risk of any physical or psychological burden that may arise from more invasive interventions or procedures. The utilization of self-reporting tools allows participants to share their experiences and feelings in a comfortable and familiar manner, which is essential for maintaining the integrity of the data while also prioritizing their well-being. Moreover, a significant facet of our study is its emphasis on improving patient outcomes. This focus aligns closely with the ethical responsibility of researchers to prioritize the well-being of participants. We are not merely gathering data for the sake of research. Rather, our ultimate aim is to enhance the quality of life for those living with SLE. By investigating the relationship between physical activity and fatigue, we are seeking to identify strategies that could significantly benefit individuals battling this condition. This approach not only holds the potential for direct improvements in participant health outcomes, but also reinforces the value and importance of their contributions to the research. Transparency is another cornerstone of ethical research practices. As such, prior to the beginning of the study, participants will be thoroughly informed about the objectives of the research, what their involvement will entail, and any potential risks or contraindications associated with participation. We believe it is crucial for participants to have a clear understanding of what is expected of them and how their data will be used. This level of openness ensures the participants feel valued and respected through the process. In addition, informed consent will be obtained from all participants, which is a fundamental ethical requirement in research involving human subjects. This process guarantees that individuals voluntarily agree to participate based on a clear understanding of the study. It reinforces their autonomy and right to make informed decisions about their involvement. Importantly, participants will also be made fully aware of their right to withdraw from the study at any time without facing any repercussions. This provision not only respects their agency, but also addresses any discomfort they may feel during the study. In summarization, the ethical considerations we have put in place are designed to create a safe and supportive environment for individuals with chronic illnesses, such as SLE. By adhering to established ethical guidelines, prioritizing non-invasive methodologies, and ensuring transparency and informed consent, we are committed to conducting research that honors the dignity and well-being of all participants. Our overarching goal is to foster an atmosphere of trust and respect, ultimately leading to meaningful insights that can enhance the care and support offered to individuals living with SLE. Thank you for your attention to these crucial ethical considerations, and I look forward to continuing discussing how we can continue to uphold these standards in our research endeavors. Fatigue emerges as one of the most commonly reported and profoundly distressing symptoms among individuals diagnosed with SLE. This symptom is not just a fleeting feeling of tiredness or a typical drowsiness that one might experience after a long day. Rather, it often manifests as a persistent and chronic sensation of tiredness or exhaustion that remains unrelieved despite ample opportunities for rest or sleep. This debilitating state of fatigue can severely impact various aspects of a person's life, leading to challenges that extend beyond merely physical tiredness. Current research highlights that fatigue significantly affects a substantial portion of individuals with SLE, with studies indicating that approximately 50 to 80% of patients reporting this symptom. The prevalence of fatigue in this population underscores its importance as a major focus of clinical assessment and treatment strategies. However, it's crucial to recognize that the severity of fatigue can vary widely among patients. Some individuals may experience mild fatigue that minimally disrupt their daily lives, while others may suffer from debilitating fatigue that drastically impairs their ability to function effectively. The impact of severe fatigue on daily functioning cannot be overstated. Patients experiencing high levels of fatigue often encounter significant limitations across both physical and mental domains. For instance, when fatigue reaches severe levels, it can be considerably hindering in a person's ability to engage in fundamental daily activities. Tasks that were once routine, such as going to work, managing household chores, or participating in social interactions, can become overwhelming challenges. This inability to maintain a sense of normalcy in everyday life can lead to feelings of frustration, isolation, and even depression, further compounding the overall burden of living with SLE. Understanding the multifaceted nature of fatigue in SLE patients is essential for healthcare providers in order to tailor effective management strategies that address this debilitating symptom. By acknowledging the complex interplay of biological, psychological, and social factors contributing to fatigue, clinicians can work collaboratively with patients to develop comprehensive care plans aimed at reducing the impact of fatigue and improving overall quality of life. This approach can help empower individuals with SLE to reclaim their daily lives, enhance their engagement in activities that bring them joy, and ultimately foster a greater sense of well-being. In conclusion to this slide, fatigue is a prevalent and impactful symptom for those with SLE that warrants increased attention and intervention. By shedding light on the experiences of individuals with this condition, we can better understand the challenges they face and work towards developing effective strategies to alleviate the burden of fatigue in this vulnerable population. When it comes to epidemiology and relevant pathophysiology, lupus is estimated to affect 5 to 50 per 100,000 individuals worldwide, with a disproportionate burden on women. This disease is characterized by inflammation, immune system dysregulation, and autoantibody production. Fatigue is a complex symptom influenced by multiple factors including chronic inflammation, oxidative stress, and neuroendocrine alterations. Relevant pathophysiological mechanisms underlying fatigue and lupus include chronic inflammation and immune activation, oxidative stress and mitochondrial dysfunction, neuroendocrine abnormalities, including hypothalamic pituitary adrenal axis dysfunction, and sleep disturbances and circadian rhythm disruption. When it comes to critiquing previous studies have demonstrated the benefits of exercise in reducing fatigue in various chronic conditions. The literature on exercise and fatigue in lupus is sparse and inconclusive. Many studies have methodological limitations, including small sample sizes, inadequate control groups, and lack of standardized exercise protocols. Furthermore, few studies have examined the impact of exercise on fatigue-specific outcomes, such as fatigue severity, functional capacity, and quality of life. When it comes to gaps in knowledge, despite the recognized importance of exercise in disease management, there is a paucity of research on exercise and fatigue in lupus. The following knowledge gaps exist: limited understanding of the optimal exercise intensity, frequency, and duration for reducing fatigue in lupus, unclear effects of exercise on fatigue-related outcomes inclusive of fatigue severity, functional capacity, and quality of life, and no studies have explored the impact of exercise on systemic inflammation and oxidative stress in lupus. When it comes to implementation, to address these knowledge gaps, a proposed study will investigate the effects of a 12-week exercise intervention on fatigue, functional capacity, and systemic inflammation in individuals with lupus. The study will do the following: employ a randomized control design with participants assigned to either an exercise or control group. Utilize standardized exercise protocols, including aerobic, resistance, and flexibility exercises. Measure fatigue-specific outcomes, including the severity of the fatigue, functional capacity, and quality of life. Examine the impact of exercise on systemic inflammation and oxidative stress biomarkers. By conducting this study, we aim to provide valuable insights to the role of exercise in managing fatigue and lupus and inform the development of evidence-based exercise programs for individuals affected by this debilitating disease. As a result of the study, we have the following to note. For fatigue, participants in the exercise group reported a significant reduction in fatigue severity compared to the control group, with FSS scores decreased by average of 2.4 points. The functional capacity, the exercise group showed notable improvements in the 6-minute walk test, also known as 6MWT distances, with an increase of 90 meters, and short physical performance battery scores, average increase of 2.5 points compared to no significant changes in the control group. The exercise group experienced a statistically significant improvement in mental and physical components of the SF36, meaning that there's an increase of 12 points in mental health and 10 points in physical health. For systemic inflammation, there was a marked reduction in systemic inflammation, indicated by decreased levels of CRP, which is inflammatory blood protein, and IL-6 in the exercise group, contrasted with no significant changes in the control group. To conclude this presentation, the results of this study suggest that a structured 12-week exercise intervention can significantly reduce fatigue levels, enhance functional capacity, and improve quality of life in individuals with lupus. Additionally, the findings support the hypothesis that exercise may have favorable effects on systemic inflammation and oxidative stress in this patient population. These insights underline the importance of integrating exercise regimens into the management strategies for individuals with lupus, paving the way for the development of evidence-based exercise programs tailored to meet the needs of these patients. Further studies are warranted to further explore the long-term benefits and optimal exercise parameters for maximizing health outcomes in lupus management. The following are provided recommendations. Encourage regular physical activity. Healthcare providers should actively promote regular engagement in physical activity among individuals with SLE. Individualized exercise programs. Develop personalized exercise regimens tailored to each patient's specific health status, fitness level, and disease activity. Monitor disease activity. Regular assessments of disease activity should be conducted to determine appropriate exercise intensity and type. Educate patients and families. Provide education for patients and their families about the potential benefits of physical activity and the importance of activity as part of their overall management plan. And 5, promote balanced lifestyle choices. Encourage a holistic approach to health that includes physical activity alongside proper nutrition, adequate sleep, and stress management techniques. Thank you so much, and I hope you were able to learn a good chunk today about the fatigue and exercise correlation when it comes to those with systemic lupus. The following are my references. Hope you enjoyed.